One of the things about this event has just been how many great organizations are coming and joining us from around the world. And an organization like Mayo Clinic, one of the world's best, just is a great validator for us. So I want to bring up Jennifer Warner, Senior Editor with Mayo Clinic, Guided by Voices.
Right,
Jennifer, take it away.
Thank you. Thank you so much. Sorry, stole my line about have you heard of Mayo Clinic? All right, let me get this first slide. All right, so I am here to tell you a little bit about the Mayo Clinic and why we feel voice-enabled content is important, not only as a health information provider, but also as a healthcare provider as well. But before I do that, I want to tell you a little bit about myself. I, like many of you in this room, have been both a passenger and a driver in this content evolution that we've been going through over the past several years. I started out in print journalism at Time Magazine in their Moscow bureau, and then I went into TV news for ABC News for a while, and then I kind of got into health reporting with ABC, and then moved on with the wave of all of the .com boom, working for CBS Health Watch and then WebMD before joining Mayo Clinic in 2014. At the Mayo Clinic, I am a senior editor, and I work on content strategy as well as these voice-first initiatives. So, one reason that Mayo, there's probably a really good reason why when he said, have you heard of Mayo Clinic, and you all nodded yes. Why would this small clinic in rural Minnesota, run by two brothers, how has it become this internationally known and respected organization that it is? Well, a lot of that comes back to our founding principle, and that founding principle is that the needs of the patient come first. So what that means in terms of patient care, well, that's something that you could probably ask the more than 1.3 million people from over 50 states and 136 countries that were cared for by the Mayo Clinic last year. But it also guides our mission as health information providers. We have evolved over time to meet the needs of the patient and their changing health information needs. So I'll tell you a little bit more about that. So we've been providing health information for a long time. We started out as a clinic. I know earlier this morning we were talking about who's the oldest company here. 150 years. Anyone? So I think we get the prize for the oldest company, and if we can evolve to meet those changing needs of the patient, you can too. So we started off in the 1900s by providing printed patient information for our patients to empower them to effectively manage their health. And what you see here is an example of a patient education flyer for patients with diabetes from the early 1900s. Then the next major evolution came with the evolution of the web. And Mayo Clinic was one of the first organizations to start a health information website. It was called Mayo Clinic or Mayo Health Oasis in 1995. That evolved to become mayoclinic.com and is now mayoclinic.org. The next stage in our evolution came with, as the web went mobile and everyone flocked to mobile apps. We went to meet them where they're at there, and we have the Mayo Clinic app. Now we're on to conversational voice and AI, and we see this as a constant evolution. Now, every time we look at each of these different channels and we view them as additive channels. So that means that when we take on another, we're not abandoning the previous channels. We're adding them to our toolkit, enabling patients to get, and consumers to get the information they want, how and when they want it. For example, we still provide patient education pamphlets. We still publish books. We still have a Mayo Clinic newsletter. We still have the website. But now we're doing more voice and AI, but we're not going to abandon those other channels. So, why do people come to Mayo Clinic.org for information? So we're certainly not the only hospital that has a website, but this graphic tells you why we're a little bit different. So all of those top 20 hospitals on the US News and World Report Honor Roll, they all have health information on their website, all except for one. I believe Duke doesn't have one. But the traffic that we see at our site is more than all of those other websites combined. So what that means is that it's not just our patients that are coming to our website for health information. It's health information seekers, and then they're coming to us at every stage of their journey. So we need to continually evolve to meet those needs. So why do they come to Mayo Clinic for their health information? There's lots of reasons. Here are just a few. We're trusted. You don't get a lot of hysteria or drug peddling. You just get good medicine and good advice, according to the New York Times. It's valued by the people who use it, and they tell us so by sending us these nice notes quite often. It's also accredited. We have complied by the HON code standard for trustworthy health information as well. And perhaps most importantly, it's evidence-based and doctor-reviewed. We adhere to a strict code of sourcing guidelines, and all of our information is reviewed and approved by Mayo Clinic experts. So now that we're at the next stage of our evolution, why voice and why now? Here are some reasons. As other speakers have alluded to, it's faster and it's natural. We can speak up to 3 times faster than we can type. A lot faster if you're a typer like me. I think you can talk a lot faster than you can type. It's also accessible. And this is something that's very important for health information providers to acknowledge. Your ears are available and your voice are available sometimes when your hands and other things are not. So this is especially important for people with disabilities, senior citizens, other people who might be dealing with other types of disabilities or medical impairments. So it's accessible. Why now? We finally have capable technology with improved speech and voice recognition powered by machine learning. It makes it possible. We're also reaching critical mass. As we've heard again today, there's millions of voice-enabled devices in our homes and millions more in our pockets. And search is surging, and we know that searches conducted by voice are expected to exceed those conducted by the internet and other means in the coming years. So now I've told you a few reasons why voice matters to Mayo Clinic. Here are some more reasons on why it should matter to any health information provider. There's not a lot of information out there yet, but there's been some early research, and we're finding that more than half of patients say that they would be interested in booking an appointment online if that were offered. Another 42% of patients would like the ability to ask their voice device about insurance, being able to ask about when you book your appointment, do they take my insurance? All these functions go hand in hand with the function of a voice-enabled device as a personal assistant. So these are it's a natural extension of that function of voice-enabled devices. Also from this survey, which is from 2018 from our friends at Yext, they're finding that 10% of people are already searching for healthcare information on the internet today via voice. And of that, about half of them are asking for the nearest urgent care clinic. Obviously, that's an urgent need. They're also asking for things like prescription reminders and drug refills. So that gives you a good, and these numbers obviously are going to grow as the use of these voice assistants grow and as trust in these devices grow. So as you can imagine, we had several objectives at Mayo when we decided how and when to enter this voice space. We knew that we wanted to be among the first major health brands to enter the voice market. We wanted to learn how to optimize our existing health information, our large health library. We wanted to learn how to use what we already had to deliver it to new clients and new channels, such as with voice. We knew we were going to have to invest in innovation and speed to accomplish these goals. And we wanted to start small and apply those learnings to inform future processes, roles, and technology. So what that all means is that we decided to adopt a crawl, walk, then run approach. So what's that first step? That first step is crawling. So we knew we already had daily health information being published through the Mayo Clinic News Network. So we thought, let's start there. So we started there with a flash briefing skill for Alexa, with dynamic content being published every day with that skill. With that experience under our belt, again, informing those future processes, our next step in walking was creating the Mayo Clinic First Aid skill for Alexa. We knew that we wanted to come up with something that would appeal to a broader audience and provide practical information on a range of issues. So this is the type of everyday assistance you can use for practical guidance for everyday first aid emergencies. Your child has a fever, you've got a cut, a scrape. And in deciding to do this, by using that crawl, walk, run approach, we decided to play to our strengths. By keeping the focus narrow, we focused on 50 first aid topics that were already existing in our health information library and adapted them for voice. So we were able to use that through Alexa. Now, with that experience under our belts, we've done our crawling, our walking, now we're getting ready to run. So our next project, you may recognize some of these names. We're currently in the process of creating voice-optimized health information for a variety of voice-enabled devices, including some of the ones that are speaking here today. So we are optimizing thousands of these devices to provide trusted first-party health information. So what that means is that when you ask Alexa or another voice-enabled devices in the coming months, increasingly that information will be coming from and attributed to the Mayo Clinic as a trusted source of that health information. So, for example, if you maybe had a little bit too much to drink last night at the bar, you could ask Alexa,
Alexa, what's the treatment for a hangover?
According to the Mayo Clinic, time is the only sure cure for a hangover. But to help yourself feel better, you can sip water or fruit juice, and try a bland snack like toast, crackers, or bouillon soup. If you have a headache, consider an over-the-counter pain reliever, but aspirin can irritate your stomach. And if you regularly drink alcohol to excess, acetaminophen can cause severe liver damage. Another option for a hangover is to go back to bed. If you sleep long enough, it may be gone when you wake up.
So don't go back to sleep just yet. I've got a few more things to say. So you'll increasingly be able to hear that information on not only Amazon Alexa devices, but also Google Assistant devices. So how do you get from here to there? How do you adapt content for voice delivery? So Mayo Clinic, like many others, don't have the luxury of starting from scratch. We needed to adapt processes to create intelligent content using our existing content. So how do you do that? How do you adapt existing content for voice delivery? First stage in that is componentization, which is a big new word that we all hear about, but it basically means breaking down that content into small, digestible chunks or concepts that allows each component to stand alone and be understood without any additional content. So kind of breaking the larger pieces into smaller chunks, that's a structural issue. Next, you can apply schema markup to those data chunks. And so those are things like DITA and XML, and that allows you to create data types. So in our case, you could create a data type called symptoms voice, or symptoms online, or symptoms patient education, varying different types of formats for different structures and delivery. Then you can also create maps that allow you to arrange those different data types for different delivery using mapping. And what this does by applying that schema markup is it makes the content understandable to not only humans, but also to machines. So it's machine readable and understandable. At Mayo Clinic, we took this to the next level. We decided to develop a master content model for omnichannel delivery. And what this does is it helped us with our definition of content types, as well as the processes and systems to go along with that. And it specifies the relationships between those different concepts. So I'll tell you a little bit more about that master content model for those of you who may not be familiar. So what it is it's a structured single model that allows you to define how all of your content assets are going to be used in each stage of its life cycle. It allows it to be authored by multiple parties, managed by multiple parties for maximum use and maximum efficiency. So what this does is it gives each player in each of these three processes in the authoring, management, and delivery clearly defined roles. And this increases efficiency and reduces resources needed to create products. But I should emphasize that it doesn't completely eliminate the need for some customization to meet your client needs. And another thing it does is it allows you, with the management, and since you've broken everything up into the small pieces, is that it reduces things like manual cutting and pasting. Raise your hand if you've ever had to cut and paste content to fit one or more different client delivery needs. So this helps you address some of those issues. Some more of the benefits of this master content model for voice is that it does facilitate that omni-channel delivery. It reduces that need to cut and paste, reduces resources needed to create new products, and it increases content reuse. It allows you to use your single components. You see this pool over here on your left. It allows you to arrange them in various ways using that using schema to create mapping, and you get your scenario A, scenario B. It allows you to reuse your content in more than one way. As you can imagine, at Mayo Clinic, we've got a lot of people working on content for a variety of different audiences. We have physician audiences, patient audiences, as well as consumer audiences. So this was especially important for us. So once you've dealt with some of those structural challenges, the next challenge is format. And you've heard people say already today, you can't just cut and paste an article from a book or an article from online into a voice bot and expect to have a good user experience. You have to adapt that existing content to address the unique needs of the voice user. Some of the things that you need to keep in mind is that you need to keep that content tightly focused on addressing a specific question. What is diabetes? What is heart failure? What are these different things? What's the question that the user is asking? And you need to succinctly answer that question without superfluous information. This is all, again, back to meeting the patient, meeting the person and the user where they are at that point in time and giving them the information that they need to know. As I mentioned, it needs to be understood on its own. You're not given the luxury of knowing what context they're seeing this in. You don't know what they read before or after this, so you need to make sure that the information can stand on its own. And you should provide high-level information, especially with health information. For health information seekers, voice is unlikely to be their final destination. It's usually going to be their first point of contact or their first inquiry. So most users will go online if they want more information or seek advice from their healthcare provider. So you want to provide high-level information. And as I mentioned, it needs to be concise, conversational. It also needs to be geographically neutral. As we know, the voice devices are everywhere, and they're used by many different languages and cultures. And so you can't say, if someone needs urgent medical attention, you can't say, call 911. What is that going to mean to someone where they don't have that? You need to explain it and keep your content geographically neutral. So what does that look like? Here's an example. So all the content creators are now choking because it can be brutal. You have to abridge the content. This is an example from heart failure risk factors. There are a lot of heart failure risk factors. As you can see, you can't just cut and paste that long list of risk factors and put it into a voice delivery. No one's going to understand what you're saying, and it's not going to be a good user experience. So you have to focus your answer on delivering the vital information that the user needs at that moment. In this particular example, we tightened up the bullet points, we grouped like risk factors together, and did other things like that to create a more conversational tone, and we drastically shortened it, okay? So if they do want to get more information, again, they can go elsewhere for the secondary information. It's not intended to be the end information. So when you're doing that, and you've already talked about the structural issues, the format issues, now we talk about editorial skills. So adapting content for voice is a new skill set for writers and editors. You have to hire and train appropriately, and it is not a one and done situation. You can't just have a one-day training and then expect them to be able to do it. You have to provide continuous feedback for continuous improvement. This is an evolving skill. It's getting better and better, and you want your product to get better and better as well. The next challenge has to do with technology. So again, as I mentioned in the development of the Mayo Clinic First Aid Skill for Alexa, we had to recognize our strengths and play to our strengths as a trusted health information provider. If you need help with other aspects of it, you need to seek out partnerships with industry leaders so you can utilize their expertise and focus on your strengths. So as I mentioned with the Mayo Clinic First Aid for Alexa, we partnered with Orbita, and also for help with our information architecture and the master content model, we worked with Simple A. So now the final challenge that I want to talk about is privacy. So this could be the ultimate challenge for voice providers. It's a concern for everyone, but it poses a unique challenge to healthcare and information providers. Healthcare providers are bound by the strict ethical codes of HIPAA regarding patient privacy and patient information, and also by legal and ethical concerns as well. So you have to be careful in being sure that you're addressing these at each stage. For example, with the Mayo Clinic First Aid Skill for Alexa, we needed to include a disclaimer the first time the user used the skill to remind them to seek emergency medical attention in the case of an emergency, and that use of the tool should not be construed as medical advice. We didn't want to have to play that in front of every single answer that they asked, so we had to use non-identifiable cookies that we could attach to the user with non-identifiable information, so Alexa would know if this user had used this skill before, had already heard the disclaimer, and so they wouldn't have to repeat it at each time. So those are just some of the ways that Mayo Clinic is looking at addressing those privacy concerns, and we'll continue to address those as we develop more products. But I hope I've shown you a few ways here how we have evolved by listening to voice, and we are guided by voice in our different ways of evolving to meet the evolving needs of the patient and consumer. And I welcome your questions. Yep. Any questions? Yes. Mm-hmm. Mm-hmm. Yeah. So what I heard is the questions about budgeting. How did we know how to budget for this, to starting in the crawl, walk, run approach? Not so much involved with the budgeting side, I'm more on the editorial side, but I think that was a big part. As you can imagine, I mentioned Mayo Clinic is 150 years old, and editorial is not the biggest department at Mayo Clinic. So we had to present a case and get buy-in from, obviously, from the practice as well. But we had to, it's kind of a proof of concept model, same as you would with any kind of medical research. So we had to show that we could do something small, do it well, have positive feedback before we could get funding to move on to these larger products. So we did have to start small, just as more of a proof of concept type thing to show that it could enhance, not only brand recognition as well as user visits and patient satisfaction, that type of thing as well. So, any other questions?
Somebody over in the back.
Okay. He's going to turn the mic on for you so you can hear your question.
Have you considered making the content interactive, or what happens when a patient would like more information about anything that you've said?
So can you repeat the first part again?
Have you considered making the content interactive instead of a block of speech?
We do have interactive. Actually, the Mayo Clinic First Aid skill for Alexa is interactive, and the answer that you get depends on the information that you provide. So she'll ask you and guide you through its dynamic content. We also are working with Sensely on a chatbot for first aid, not for first aid, but for basic healthcare information. So we are working on those initiatives as well.
Hi, I was curious about your dialogue and the way that you started to move the content from, sort of the long form written format and moving it into a voice-centered interface. In terms of creating, the optimal responses in that format, could you talk at all about maybe like your user testing process and how you decided that this is the ideal response to answer about risk factors for diabetes, for example?
Okay. Well, there's a lot of factors that go into that. Again, we have to recognize our strengths and our weaknesses. We have worked with several partners, like Orbita and others who have worked extensively and have some data that can help guide us as well. We're also, just trial and error. We literally did a round table and read things to each other. And because we're so used to our certain.org form that it really took a while for us to kind of understand how things would sound as opposed to how they were read. So it's definitely evolving, and I'm talking like in weeks and months. It's not like a year-long thing. It's happened really quickly as this has evolved. But it has been a lot of seeking information from the experts and just trial and error, as well as leaning on our experts and there's physician advisors that work with us and that can make sure that we're including and not leaving out important information. So, for example, if we are condensing a long list of risk factors, I would never say the risk factors of diabetes are 1, 2, and 3. I might say some of the most common risk factors are this. Less common ones are this. Or in children, you might experience this. So we have to be clear when we are abridging it. So it's clear that there might be some other lesser known things there and they should seek more information. One more question. Yeah.
Hi, I was just curious, because at the end of the day, you guys are still a business. So do you guys actually make any revenue from these skills or anything, or is it just purely like help and all that?
There's a lot of reasons why we do it. I mean, one is brand recognition. It does drive patients to our site as well, and we do work with other partnerships and have various relationships with other partners as well. So, But we do view it as our primary mission of putting the needs of the patient first and empowering people to make good health decisions. So it is part of our mission, and we are a nonprofit. So
Let's give it up for Jennifer Warner. Thank you.
thank you.